Question 1. A nurse is caring for a client experiencing an acute asthma exacerbation. Which of the following is the priority nursing action? A. Administer ordered oral corticosteroids. B. Provide client education on trigger avoidance. C. Auscultate lung sounds and administer a rapid-acting bronchodilator. D. Encourage deep breathing and coughing exercises. Answer: C. Auscultate lung sounds and administer a rapid-acting bronchodilator. The concept tested here is priority nursing action during an acute asthma exacerbation, where the keyword priority indicates the most immediate life-saving intervention. In an acute asthma attack, the primary concern is airway narrowing and bronchospasm, which quickly impairs breathing. Administering a rapid-acting bronchodilator, such as albuterol, is crucial to open the airways quickly, and assessing lung sounds helps confirm the presence of wheezing and monitor the effectiveness of the intervention. For example, if a client is severely dyspneic, administering the bronchodilator is more urgent than teaching or waiting for oral medication to take effect. Always remember that maintaining a patent airway and ensuring adequate oxygenation are the top priorities in any respiratory emergency. Question 2. A client with chronic obstructive pulmonary disease, COPD, is prescribed oxygen therapy at 2 liters per minute via nasal cannula. The nurse understands this low flow rate is important for which reason? A. To prevent oxygen toxicity. B. To avoid depressing the client's hypoxic drive. C. To reduce the risk of pulmonary edema. D. To improve the client's carbon dioxide excretion. Answer: B. To avoid depressing the client's hypoxic drive. This question tests the concept of oxygen administration in clients with COPD, focusing on the hypoxic drive. In clients with long-standing COPD, their respiratory drive primarily relies on low oxygen levels, hypoxia, rather than high carbon dioxide levels, which is the normal stimulus for breathing. Providing high-flow oxygen can diminish this hypoxic drive, causing the client to breathe less and retain more carbon dioxide, potentially leading to respiratory acidosis and altered mental status. For instance, if a COPD client receives too much oxygen, their body might mistakenly think it has enough oxygen and reduce its breathing effort, leading to dangerous CO2 buildup. Remember that for COPD clients, a little oxygen goes a long way to support breathing without suppressing their natural respiratory trigger. Question 3. The nurse is assessing a client admitted with pneumonia. Which assessment finding is most concerning and requires immediate intervention? A. Client reports a productive cough with yellow sputum. B. Respiratory rate of 28 breaths per minute with oxygen saturation of 88% on room air. C. Temperature of 100.8 degrees Fahrenheit 38.2 degrees Celsius. D. Client states feeling fatigued and weak. Answer: B. Respiratory rate of 28 breaths per minute with oxygen saturation of 88% on room air. This question evaluates the nurse's ability to prioritize assessment findings in a client with pneumonia, with most concerning highlighting a life-threatening change. A respiratory rate of 28 breaths per minute combined with an oxygen saturation of 88% on room air indicates significant respiratory distress and hypoxemia, which means the client is not getting enough oxygen. While other findings like fever, cough, and fatigue are common in pneumonia, severe hypoxemia poses an immediate threat to vital organ function and requires urgent intervention, such as oxygen administration. For example, a client with oxygen saturation below 90% is at risk for tissue damage and organ dysfunction, making it the most critical finding. Always remember that a low oxygen saturation is a direct indicator of inadequate gas exchange and demands immediate attention. Question 4. A client with a new tracheostomy tube requires suctioning. Which of the following is an essential step prior to initiating suctioning? A. Hyperoxygenate the client with 100% oxygen. B. Administer a sedative to reduce discomfort. C. Instill normal saline into the tracheostomy tube. D. Document the last time the client was suctioned. Answer: A. Hyperoxygenate the client with 100% oxygen. The concept tested here is safe tracheostomy suctioning technique, and essential step prior to initiating suctioning points to a critical pre-procedure action. Hyperoxygenating the client with 100% oxygen for at least 30 to 60 seconds before suctioning helps to prevent hypoxemia during the procedure, as suctioning temporarily removes air from the airways. Instilling saline is generally not recommended as it can introduce bacteria and is not an evidence-based practice for routine suctioning. For example, if a client has low oxygen reserves, performing suctioning without pre-oxygenation could lead to severe desaturation and cardiac arrhythmias. Always prioritize patient safety by ensuring adequate oxygenation before any procedure that may compromise breathing. Question 5. A nurse is reviewing a client's arterial blood gas, ABG, results, pH 7.30, PaCO 255 mm of mercury, HCO 324 milliequivalent/L. This indicates which acid-base imbalance? A. Metabolic acidosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer: B. Respiratory acidosis. This question tests the interpretation of arterial blood gas results and the concept of acid-base balance. The pH of 7.30 indicates acidosis, normal pH is 7.35 to 7.45, and the elevated PaCO 2 of 55 mm of mercury, normal is 35 to 45 mm of mercury, indicates a respiratory component, specifically carbon dioxide retention. The HCO3 bicarbonate is within normal limits, indicating no metabolic compensation yet or a purely respiratory issue. For instance, in conditions like COPD exacerbation or hypoventilation, the lungs fail to adequately excrete CO2, leading to this type of imbalance. When interpreting ABGs, remember to first look at the pH to determine acidosis or alkalosis, then look at PaCO 2 for respiratory cause and HCO3 for metabolic cause. Question 6. A client is prescribed a metered dose inhaler, MDI, with a spacer. The nurse provides education on its use. Which statement by the client indicates a need for further teaching? A. I will shake the inhaler well before each use. B. I should breathe in slowly and deeply while pressing down on the canister. C. I will hold my breath for about 5 to 10 seconds after inhaling. D. I can use my MDI immediately after cleaning the spacer with warm, soapy water. Answer: D. I can use my MDI immediately after cleaning the spacer with warm, soapy water. This question focuses on client education regarding the proper use of an MDI with a spacer, and indicates a need for further teaching points to an incorrect understanding. Spacers should be cleaned regularly with warm, soapy water, but they must be allowed to air dry completely before the next use to prevent any residue from affecting medication delivery or promoting bacterial growth. Using it immediately after washing, while still wet, is incorrect and can lead to ineffective drug delivery. For example, residual water droplets can cause the medication to clump or stick to the sides of the spacer, preventing the full dose from reaching the lungs. Always teach clients to air dry their spacers thoroughly to ensure optimal medication delivery. Question 7. A nurse is caring for a client with a chest tube inserted for a pneumothorax. The nurse observes continuous bubbling in the water seal chamber. What is the most appropriate initial nursing action? A. Clamp the chest tube immediately. B. Reposition the client to promote drainage. C. Check for air leaks in the tubing and insertion site. D. Increase the suction setting on the chest tube drainage system. Answer: C. Check for air leaks in the tubing and insertion site. This question tests the nurse's knowledge of chest tube management, specifically identifying and troubleshooting issues related to continuous bubbling. Continuous bubbling in the water seal chamber after a pneumothorax insertion typically indicates a persistent air leak in the system, either from the client's pleural space or from a disconnection/loose connection in the tubing or at the insertion site. Clamping the tube is generally contraindicated unless specifically ordered for a brief period to locate a leak or when changing the system. For instance, carefully assess all connections from the client to the drainage system, and check the dressing around the insertion site for integrity. Always prioritize finding the source of a continuous air leak to ensure the chest tube system is functioning properly and the pneumothorax is resolving. Question 8. A client is prescribed a bronchodilator and a corticosteroid inhaler for asthma. The nurse provides instruction on the correct order of administration. Which statement is correct? A. The corticosteroid inhaler should be used first, followed by the bronchodilator. B. The bronchodilator should be used first, followed by the corticosteroid. C. The order of administration does not matter. D. Only one inhaler should be used per day. Answer: B. The bronchodilator should be used first, followed by the corticosteroid. This question addresses the correct sequence for administering multiple inhalers, a key aspect of asthma management. The bronchodilator should always be used first because it opens the airways, allowing the corticosteroid medication to penetrate deeper into the lungs and be more effective. This concept ensures optimal drug delivery and therapeutic benefit for the client. For example, using a bronchodilator first is like opening a door before trying to spray air freshener into a closed room. Always remember to open before you treat when administering bronchodilators and corticosteroids. Question 9. A client is admitted with suspected pulmonary embolism, PE. Which symptom would the nurse anticipate as a classic manifestation of PE? A. Productive cough with purulent sputum. B. Bilateral peripheral edema. C. Sudden onset of dyspnea and pleuritic chest pain. D. Bradycardia and hypotension. Answer: C. Sudden onset of dyspnea and pleuritic chest pain. This question focuses on the classic clinical presentation of a pulmonary embolism, which is a life-threatening condition. A pulmonary embolism typically manifests with the sudden onset of shortness of breath, dyspnea, and sharp, localized chest pain that worsens with breathing, pleuritic chest pain, due to the blockage of blood flow to part of the lungs. While other symptoms might be present, these two are highly indicative and require immediate investigation. For instance, a client who suddenly gasps for air and clutches their chest after surgery should immediately be evaluated for a PE. Recognize that the abrupt nature of these symptoms is a critical clue for suspecting a pulmonary embolism. Question 10. A client with chronic bronchitis reports increasing shortness of breath, fatigue, and dependent edema. The nurse recognizes these symptoms as indicative of which complication? A. Acute respiratory distress syndrome, ARDS. B. COR pulmonale. C. Pneumothorax. D. Pulmonary hypertension. Answer: B. COR pulmonale. This question tests the understanding of common complications in chronic bronchitis, specifically the development of COR pulmonale. COR pulmonale refers to right-sided heart failure caused by long-term high blood pressure in the pulmonary arteries and right ventricle of the heart, often due to chronic lung conditions like bronchitis. The increasing shortness of breath, fatigue, and dependent edema are classic signs of right-sided heart failure. For example, The constant strain on the right side of the heart from difficulty pushing blood through narrowed pulmonary vessels eventually causes it to weaken and fail, leading to fluid retention. Remember that in chronic lung diseases, the heart eventually bears the brunt of the increased pulmonary pressure, leading to heart failure symptoms. Question 11. The nurse is providing discharge teaching for a client with newly diagnosed latent tuberculosis, TB, infection. Which statement should the nurse include? A. You are contagious and should avoid contact with others until treatment is complete. B. You will need to take anti-tuberculosis medications for 6 to 9 months. C. You do not need treatment, as latent TB is not a serious condition. D. You will experience active symptoms of TB within a few weeks. Answer: B. You will need to take anti-tuberculosis medications for 6 to 9 months. This question focuses on the management and client education for latent tuberculosis infection. Latent TB means the client has the TB bacteria in their body but does not have active symptoms and cannot spread the infection to others. Treatment with anti-tuberculosis medications, typically for 6 to 9 months, is crucial to prevent the latent infection from progressing to active TB disease. While latent TB is not contagious, it is a serious condition that requires treatment to prevent future active disease. For instance, a client with latent TB might feel perfectly healthy but still needs to complete the medication course to eradicate the dormant bacteria and prevent reactivation. Always emphasize the importance of completing the full course of medication, even without symptoms, to prevent the progression of latent TB. Question 12. A client receiving mechanical ventilation suddenly becomes agitated and experiences high-pressure alarms. What is the nurse's priority action? A. Administer a sedative as prescribed. B. Manually ventilate the client with a bag valve mask. C. Assess the client for kinks in the tubing or secretions in the airway. D. Increase the ventilator's tidal volume setting. Answer: C. Assess the client for kinks in the tubing or secretions in the airway. This question tests the nurse's immediate response to a high-pressure alarm on a mechanical ventilator, emphasizing priority action. A high-pressure alarm typically indicates an obstruction or resistance to airflow. Before administering sedatives or changing ventilator settings, the nurse must first assess for easily correctable causes such as kinks in the ventilator tubing, the client biting the endotracheal tube, or mucus plugging the airway. For example, if the client is biting the tube, inserting an oral airway would quickly resolve the alarm. Always remember to assess the client and the tubing first to identify and correct the cause of the alarm. Question 13. A nurse is educating a client with emphysema about energy conservation techniques. Which instruction would be most beneficial? A. Perform all activities in the morning when energy levels are highest. B. Avoid all physical activity to conserve energy. C. Pace activities throughout the day, alternating rest with activity. D. Rely on others for all daily tasks to prevent exertion. Answer: C. Pace activities throughout the day, alternating rest with activity. This question addresses energy conservation strategies for clients with emphysema, a chronic lung condition causing significant dyspnea and fatigue. Pacing activities throughout the day, by alternating periods of activity with rest, helps to prevent overexertion and conserve energy, allowing the client to accomplish more without becoming overly breathless or fatigued. Attempting all activities at once or avoiding activity entirely are not effective or healthy strategies. For instance, a client might prepare breakfast, then rest, then shower, then rest again. Encourage clients to break down large tasks into smaller, manageable steps to minimize shortness of breath. Question 14. A nurse is preparing to administer the influenza vaccine to a client with a history of chronic respiratory conditions. The client asks why they need the vaccine. What is the nurse's best response? A. The vaccine will prevent you from getting any respiratory infection this winter. B. It significantly reduces your risk of developing severe flu complications like pneumonia. C. It will help improve your baseline lung function. D. It is required for all individuals over 65 years old. Answer: B. It significantly reduces your risk of developing severe flu complications like pneumonia. This question tests the nurse's understanding of the rationale for influenza vaccination in vulnerable populations. While the flu vaccine doesn't guarantee complete prevention of all respiratory infections, its primary benefit for clients with chronic respiratory conditions is to significantly reduce the risk of severe illness, hospitalizations, and life-threatening complications like pneumonia, which can be devastating for compromised lungs. The vaccine does not improve baseline lung function. For example, if a client with asthma gets the flu, it can trigger a severe exacerbation, but the vaccine can lessen the severity and duration of the illness. Emphasize that vaccination is a crucial protective measure against serious illness for those with chronic respiratory issues. Question 15. A client with a new diagnosis of obstructive sleep apnea, OSA, is prescribed continuous positive airway pressure, CPAP. The nurse explains the primary purpose of CPAP is to A. Deliver oxygen at a high flow rate. B. Provide continuous airflow to keep the airway open during sleep. C. Stimulate the diaphragm to improve breathing. D. Monitor the client's oxygen saturation continuously. Answer: B. Provide continuous airflow to keep the airway open during sleep. This question assesses the fundamental understanding of CPAP therapy for obstructive sleep apnea. The primary purpose of CPAP is to deliver a continuous stream of positive pressure air, which acts as a pneumatic splint to keep the upper airway from collapsing during sleep, thereby preventing apneic episodes. CPAP primarily provides pressure, not necessarily high-flow oxygen, and it does not directly stimulate the diaphragm. For instance, imagine the continuous air pressure gently holding open a floppy straw so air can pass through. Remember that CPAP's main role is to maintain airway patency and prevent respiratory arrest during sleep. Question 16. A nurse is assessing a client with acute respiratory distress syndrome, ARDS. Which assessment finding is a hallmark characteristic of ARDS? A. Bradycardia and hypotension. B. Bilateral lung infiltrates on chest X-ray despite normal cardiac function. C. Productive cough with thick, green sputum. D. Improvement in oxygenation with increased oxygen therapy. Answer: B. Bilateral lung infiltrates on chest X-ray despite normal cardiac function. This question explores the key diagnostic feature of acute respiratory distress syndrome, ARDS. A hallmark characteristic of ARDS is the presence of widespread bilateral pulmonary infiltrates, fluid in the lungs, on chest X-ray, indicating significant lung inflammation and fluid accumulation, coupled with severe hypoxemia that is refractory, does not improve, to increasing oxygen concentrations. This occurs in the absence of left-sided heart failure or fluid overload as the primary cause. For example, a client with ARDS might require high levels of oxygen and still have very low oxygen saturation because the lungs are too stiff and filled with fluid to facilitate gas exchange. Remember that ARDS is often characterized by widespread whiteout on a chest X-ray, indicating severe lung injury and fluid. Question 17. The nurse is caring for a client post-thoracotomy. The client reports severe pain on the affected side. What is the most appropriate initial nursing action? A. Encourage deep breathing exercises. B. Administer prescribed analgesic medication. C. Notify the healthcare provider immediately. D. Reposition the client on the unaffected side. Answer: B. Administer prescribed analgesic medication. This question tests the nurse's immediate response to acute pain in a post-operative thoracotomy client. Severe pain after a thoracotomy, surgical incision into the chest wall, is expected and can significantly impair the client's ability to breathe deeply, cough, and participate in mobility, increasing the risk of respiratory complications like atelectasis and pneumonia. Administering prescribed analgesic medication is the most appropriate initial action to alleviate the pain and facilitate respiratory function. For instance, if the pain is controlled, the client will be much more willing and able to take deep breaths and clear secretions. Always prioritize effective pain management to prevent complications and promote recovery in surgical clients. Question 18. A client is experiencing status asthmaticus. Which medication would the nurse anticipate administering first? A. Oral prednisone. B. Inhaled short-acting beta-agonist, SABA. C. Intravenous magnesium sulfate. D. Inhaled long-acting beta-agonist, LABA. Answer: B. Inhaled short-acting beta-agonist, SABA. This question focuses on the immediate management of status asthmaticus, a severe, life-threatening asthma attack that does not respond to usual treatment. In such an emergency, the priority is rapid bronchodilation to open the airways, and an inhaled short-acting beta-agonist, SABA, like albuterol, is the first-line and most rapidly effective treatment. Oral prednisone takes hours to work, for magnesium is a second-line agent, and LABAs are for long-term control, not acute attacks. For example, a client struggling to breathe needs immediate relief, and a SABA works within minutes to relax the bronchial smooth muscles. Always remember that for acute asthma exacerbations, SABAs are the rescue medications. Question 19. A client is receiving oxygen therapy via a simple face mask at 8 liters per minute. The nurse understands that this delivery device is appropriate for oxygen concentrations of A. 24 to 44%. B. 60 to 80%. C. 40 to 60%. D. 90 to 100%. Answer: C. 40 to 60%. This question tests knowledge of oxygen delivery devices and the approximate oxygen concentrations they provide. A simple face mask, when used at flow rates of 6 to 10 liters per minute, delivers an oxygen concentration, VO2, of approximately 40 to 60%. Other devices deliver different concentrations, such as a nasal cannula, 24 to 44% at 1 to 6 liters per minute, or non-rebreather mask, 60 to 80% or higher. For example, if a client needs a moderate level of oxygen, a simple face mask is a common choice. Understanding the VO2 delivered by each device helps the nurse select the appropriate equipment based on the client's oxygenation needs. Question 20. When assessing a client's breath sounds, the nurse hears high-pitched, musical sounds primarily on expiration. The nurse would document this finding as A. Crackles. B. Ronchi. C. Wheezes. D. Pleural friction rub. Answer: C. Wheezes. This question assesses the nurse's ability to identify and document abnormal breath sounds. High-pitched, musical sounds, particularly on expiration, are characteristic of wheezes, which occur when air is forced through narrowed airways, such as in asthma or COPD exacerbations. Crackles, rowls, are short, popping sounds, ronchi are low-pitched, rumbling sounds, and a pleural friction rub is a grating sound caused by inflamed pleural surfaces rubbing together. For example, imagine a narrow tube where air is whistling through. Identifying specific breath sounds helps in diagnosing and monitoring respiratory conditions. Question 21. A client with cystic fibrosis, CF, is prescribed pancreatic enzyme supplements. The nurse should instruct the client to take these enzymes. A. On an empty stomach, first thing in the morning. B. With every meal and snack. C. Only when experiencing abdominal pain. D. After meals, before bedtime. Answer: B. With every meal and snack. This question addresses the essential management of pancreatic enzyme replacement therapy for clients with cystic fibrosis. Clients with CF have impaired pancreatic enzyme secretion, leading to malabsorption of fats, proteins, and fat-soluble vitamins. Pancreatic enzyme supplements must be taken with every meal and snack to aid in the digestion and absorption of nutrients from food. Taking them at other times or only with pain would be ineffective. For instance, think of the enzymes as helpers that must be present in the digestive tract exactly when food arrives to break it down. Always emphasize that these enzymes are crucial for nutrient absorption and should coincide with food intake. Question 22. A nurse is reviewing the medication list for a client with asthma and notes the client is taking salmeterol. The nurse teaches the client that this medication is A. A rescue inhaler for acute symptoms. B. A long-acting bronchodilator for maintenance therapy. C. An inhaled corticosteroid to reduce inflammation. D. An oral medication for severe exacerbations. Answer: B. A long-acting bronchodilator for maintenance therapy. This question tests knowledge of common asthma medications, specifically salmeterol. Salmeterol is a long-acting beta agonist, LABA, and is used as a maintenance medication to provide long-term bronchodilation and control asthma symptoms, not for acute relief during an asthma attack. It is often combined with an inhaled corticosteroid. For example, salmeterol provides sustained opening of the airways throughout the day, preventing asthma symptoms from flaring up, unlike a rescue inhaler that works quickly but for a short duration. Remind clients that LABAs are for preventing problems, not fixing them once they start. Question 23. A nurse is providing education to a client on how to use an incentive spirometer. Which instruction is most appropriate? A. Exhale forcefully into the mouthpiece to make the indicator rise. B. Inhale slowly and deeply through the mouthpiece, keeping the indicator between the lines. C. Use the incentive spirometer once per day, preferably in the morning. D. Cough immediately after each inhalation to clear secretions. Answer: B. Inhale slowly and deeply through the mouthpiece, keeping the indicator between the lines. This question evaluates the nurse's ability to teach the correct use of an incentive spirometer, a device used to improve lung expansion and prevent atelectasis. The key instruction is to inhale slowly and deeply through the mouthpiece, aiming to lift the indicator to a predetermined goal, which encourages maximum lung inflation. Exhaling into it or using it infrequently are incorrect uses. For example, imagine sipping air through a straw to expand a balloon. The slower and deeper the sip, the more the balloon expands. Always stress slow, deep inhalation to achieve optimal lung expansion and prevent postoperative complications. Question 24. A client with chronic bronchitis is prone to developing respiratory infections. Which nursing intervention is most important to include in the client's care plan? A. Restricting fluid intake to decrease mucus production. B. Encouraging smoking cessation. C. Administering prophylactic antibiotics daily. D. Providing a high-calorie, low-protein diet. Answer: B. Encouraging smoking cessation. This question addresses a crucial nursing intervention for clients with chronic bronchitis, particularly concerning infection risk. Smoking is the primary cause and exacerbating factor for chronic bronchitis, leading to increased mucus production, impaired ciliary function, and higher susceptibility to respiratory infections. Encouraging and supporting smoking cessation is the single most important intervention to slow disease progression, reduce symptoms, and decrease the frequency of infections. Restricting fluids can thicken secretions, and prophylactic antibiotics are not routinely recommended. For instance, stopping smoking is like removing the constant irritant that is damaging the lungs and making them vulnerable to illness. Always prioritize helping clients with chronic respiratory conditions quit smoking to improve their overall lung health. Question 25. A client presents to the emergency department with sudden onset of severe shortness of breath, diminished breath sounds on one side, and tracheal deviation to the unaffected side. The nurse suspects which condition? A. Pneumonia. B. Pleural effusion. C. Tension pneumothorax. D. Acute bronchitis. Answer: C. Tension pneumothorax. This question tests the nurse's ability to recognize the signs and symptoms of a tension pneumothorax, a life-threatening emergency. A tension pneumothorax occurs when air enters the pleural space during inspiration but cannot exit during expiration, leading to a rapid buildup of pressure that collapses the lung and shifts mediastinal structures, like the trachea and heart, to the unaffected side. Sudden severe dyspnea, absent or diminished breath sounds on the affected side, and tracheal deviation are classic, critical signs. Pneumonia, pleural effusion, and bronchitis typically do not cause tracheal deviation or such rapid, severe respiratory collapse. Remember that tracheal deviation is a late and ominous sign of a tension pneumothorax, indicating extreme pressure and requiring immediate intervention.